From our 22 News Broadcast Center, this is 22 News in Focus.
Good Sunday afternoon. Welcome to 22 News in Focus. I'm Ashley Afonso. This week we are discussing two issues: cancer survival and mental illness. The month of May is Mental Health Awareness Month, and later in the program we'll be talking with mental health professionals about the diagnosis and treatments available. But first, we're going to look at the support groups for people who have survived cancer. Thousands of people every year get a clean bill of health after undergoing cancer treatments. During treatment, there are many support programs available for patients, their families, and caregivers. But what about after treatment? Joining me now to discuss the Survivor Journeys initiative are Dr. Jay Burton, a primary care physician who is also a cancer survivor himself, and Catherine Walsh, a licensed independent clinical social worker specializing in psychosocial oncology. So thank you both for being here with us today.
Thank you.
My first question for you is just to tell me a little bit about yourselves and how you got involved in this field.
Well, I was brought in kicking and screaming. I've been a primary care physician in Enfield, part of the Springfield Medical Associates organization. But in 2010, I was diagnosed with acute myeloid leukemia. Anytime something says acute, that means you have to deal with it pretty quickly. I had to have chemotherapy, and that put me into remission. Eventually, I had more chemotherapy, a stem cell transplant, total body radiation. Recovered, was able to get back into work, but I realized that I had a pretty unique experience and skill set, and thought it was really important to give back and develop Survivor Journeys to help with the emotional and social support for cancer survivors, their families, and caregivers.
All right, and Catherine, tell me about your experiences.
Well, actually, this is my 40th year as an oncology social worker. I started back in 1978 at the Dana-Farber Cancer Institute in Boston when they opened their first transplant unit, and I was hired as a social worker there, and then moved out here to Western Massachusetts in the mid-'80s and became the director of psychosocial services for Hospice of Hampshire County, now Cooley Dick Hospice VNA Alliance, and finished my Ptsd. I teach full-time at Westfield State University in the social work program there, but I have had a private practice in oncology social work since 1988, and so have seen many, many, many survivors and their families facing the issues that come after cancer treatment.
Okay, so you created Survivor Journeys. Did you see a great need for people who have now beat cancer but still need support?
There's a great need here, there's a great need everywhere, and I think that it's always important to define who a cancer survivor is. And that's really at the time of diagnosis, because that's the predominant definition. And that's when you go into survival mode. So you have to figure out, what beyond the treatment plan, how does this fit into your life, or how does your life fit into this? And then the definition of cancer survivorship is living, with and beyond cancer. So some people feel they're not a survivor until they finish their treatment. That's not the case at all.
So tell us a little bit about Survivor Journeys.
Survivor Journeys is a nonprofit organization that we've been around for a little bit more than 3 years. We have cancer-specific support groups. We have blood cancer group. We have breast cancer group. We have an all-cancer group. We've started a caregiver group because we can't forget the caregivers. They're so important and they need support. We have a mentoring program which has national ties, where people that are further along in their journey help support people that are just starting. And this is any type of cancer. It includes caregivers. We are pretty young in the organization. But if we don't have somebody locally, we can reach out to our partners throughout the whole country. We get between 5 and 10 requests from our partners every day. This is pretty novel. There's nothing like this between Boston and New York. And we're growing, and if people are interested in becoming mentors or need support, they should always contact us. We have a pet therapy program. We're also going to be talking about our educational program, Cancer Survivorship 101, on June 9th, a little bit later. In development is a pediatric cancer caregiver mentoring program, and a young adult cancer survivor group. We have some other ideas that are really in the formative stages. If people have ideas about services we don't offer, all they need to do is contact us. We have a lot of ideas. We need people to embrace what we're doing and volunteer and work with us.
Why would you say programs like this are so important after treatment for people who go through it, their families, and the caregivers, as you just mentioned?
Well, part of the reason that Jay and I have partnered up is because working for the past 40 years and seeing the various kinds of after effects, long-term effects that people experience after cancer treatment might be physical, they might be psychological, they might be emotional. For example, neuropathy, which can impact the work that people can do once they finish treatment, their motor and fine motor skills can be very debilitating. Also, people often do realize the full impact of treatment and how it has changed their lives only after they've completed treatment. I think that was probably the case for you as well, Jay. And having worked in the Hampshire County area for most of my career here in Western Massachusetts and worked closely with Cancer Connection, where I facilitated a breast cancer support group for 12 years, I could see the tremendous need both for support groups and also for mental health intervention that's cancer informed. My private practice is full continuously. Jay and I partnered together to develop a cancer informed mental health cancer team at West Central Family Counseling in West Springfield, because there aren't enough cancer-informed therapists in the area who really understand what both survivors and their family members go through. So I'm thrilled that Survivor Journeys is offering the variety of groups and services that they are, because it's very much needed, particularly in the greater Springfield area.
Okay, if someone is watching this and has gone through cancer themselves, what kind of support groups are available through you guys or just locally here in Western Massachusetts?
Well, our groups, we have a blood cancer group that we partner with the Cancer House of Hope. We have a blood cancer group that we partner with Leukemia Lymphoma Society. We have an all cancer group, which means anyone who has a cancer that we don't have other groups for, and we have a caregiver group. The uniqueness of our program is we're not in one place. We don't have a physical space. We're in the community. Because as a cancer survivor, I can tell you the last place you ever want to go is the hospital for anything. And that's just because you're there so much to begin with. So being in the community is really what our focus is. It works well for people. If people have trouble getting there, we can arrange for some transportation. The mentoring program you can do from your home. You know, you could do Skype or FaceTime or telephone. And pet therapy, we would meet people where they need to be met. The interesting thing is that we're also trying to develop a remote platform, specifically initially for our caregiver group, because if you're a caregiver, you really can't leave your home sometimes. And to be able to participate in something remotely is something that we're looking into and trying to initiate.
Is there any kind of help for people who are going through depression or anxiety after treatment?
Well, again, support groups play a very crucial role in that, as well as the mentor program, which is so unique, because I think often people feel the most helpful kind of support comes from people who understand what it's like to be dealing with the effects of cancer, and there's nothing like someone else who's been through a similar treatment or a similar diagnosis. But many times people do struggle with anxiety, as Jay mentioned in our in the Survivorship 101 program taking place on June 9th. I'll be speaking about fear of recurrence, which is an almost universal concern. Once you've had that rug pulled out from under you and you no longer have that sense of yourself as a, completely healthy person who doesn't have to contend with the kinds of things that you think of as happening only to other people, you have a sense of vulnerability that really is very challenging, particularly during your annual annual checkups, your annual mammogram, your annual scans. So there are wonderful strategies that we can teach people to cope with that anxiety. I use a lot of cognitive behavioral therapy, which is useful for insomnia in particular, which is a side effect that many people struggle with after chemotherapy. And it can be very, very effective for anxiety and depression as well. Again, it's very helpful to see a therapist or a clinician who has been trained in the side effects of cancer and the experience of cancer treatment as well, because sometimes it's hard to differentiate what might be a side effect of treatment, because some treatments actually even do cause depressed mood, and what is due to other factors like social isolation or a changed sense of identity, the changed roles and responsibilities that family members go through, whether they're a caregiver or they're the person with cancer, can have a significant impact on the way that people feel about themselves and create a lot of anxiety, including financial anxiety. We now have a new term called financial toxicity that relates to the kind of expense that is incurred just even for transportation or co-pays that can make it very, very difficult on families.
All right, we'll continue our conversation after a short break. You're watching 22 News in Focus. Welcome back to 22 News in Focus. We're talking about life before and after treatment for cancer patients, their families, and caregivers. So let's continue this conversation. What advice do you have for someone either going through treatment or has just finished up treatment?
Well, you have to remember that there's a whole lot of life that goes on outside of the medical exam room. That focuses mostly on medications, testing, referrals, but then how do you live your life? And there's no structure for that. So that's where Survivor Journeys comes into place, as well as other organizations throughout our community. The transition from the oncologist to a primary care physician it doesn't have structure either. And there's something called a Survivorship care plan that really details what the cancer diagnosis is, the cancer treatment, the complications of the cancer and the treatment, and then what surveillance has to be done down the line. Because treatments, while they may help you with your cancer recovery and hopefully cure, there are things that treatment can cause later down the line, maybe secondary cancers. Kathy talked about neuropathies, lots of different things that have to be focused on. And the primary care community throughout the world does not have a focus on how to care for cancer survivors going forward. The Survivorship Care Plan, while still being researched to see how effective it is a tool that can help that transition. I'm old enough in practice to know that when I would get a patient from an oncologist a few years ago, my desk would have a skyscraper of records. It's better now, but it still needs to be more concise. I'm interested in primary care cancer survivorship in my practice. However, most primary care docs aren't. And to be able to pick up the ball and run with it, they need concise information from the oncology physician. Hopefully that will improve.
What questions should people going through treatment or that have finished should be asking their doctors?
I can tell you there's two things that I would do, and if I had the ability to produce a YouTube video, I would have a patient with their oncologist and the patient asking the oncologist, what does my primary care doctor know about my cancer? And then the other part of the vignette would be the patient with their primary care doc and saying, what does my chart say about my cancer? Because unfortunately, too many primary care charts only have the following under the problem list of a cancer survivor. As an example, history of leukemia. That's all it says. And you can't take care of a cancer survivor with that information without more information that's in every note, not stacked away in the electronic health record. It has to be in every note.
Okay, there's an event coming up on June 9th that you are putting together. Can you tell us a little bit about it?
It's called Cancer Survivorship 101. It's a pretty unique event. I can say that because I'm involved nationally in cancer survivorship, and this is not being done anywhere. So our board on Survivor Journeys recognized that we have a number of programs, but we'll never be able to optimally utilize those programs until we educate people about cancer survivorship. Even the two definitions we talked about before, what is a cancer survivor? What is cancer survivorship? That will educate people immensely. But what we're going to be talking about is survivorship care plans. We're going to be Kathy's going to be talking about, again, anxiety and fear of cancer recurrence. We're going to be talking about late effects of cancer treatment. We're going to be talking about anxiety, again, fatigue, sleep, exercise, nutrition. Something that never gets to be talked about is disability insurance. We're also having a keynote speaker, Natasha Verma, who is an anchor at NBC Boston, who in the morning anchor, who's also a Hodgkin's lymphoma survivor. We have vendors from various cancer-related organizations, including the American Cancer Society, Leukemia and Lymphoma Society, Bright Star Health. We have Camp Casco, which is a pediatric cancer camp that takes place in the Berkshires. We have Big Y, who I hope is going to be get involved in cancer nutrition. We have Livestrong from Westfield, which has a great program in terms of for 12 weeks for cancer survivors for physical therapy. And then we're inviting Club Fitness. We hope we'll work with Livestrong to develop aftercare programs. The Cancer House of Hope will be there. Natasha Verma's foundation will also be there. And if I've forgotten anyone else, I apologize.
Who is welcome and what is the cost of this?
First of all, this is free. Okay, we wanted to take away any barriers. Again, we're a nonprofit organization. So we have sponsors like wwlp, Mercedes of Springfield. We have a couple of other sponsors that we're waiting on. But a lot of this is coming out of our bank because this is really important. We want to get the word out. There's a free breakfast. First of all, this is for cancer survivors, their families, and caregivers. But any medical professionals, I can say primary care docs, they don't know anything about cancer survivorship. I can say that with a 100% degree of certainty. So if they came, they would learn something. Other mental health professionals, physical therapists, occupational therapists, registered dietitians. If the general public wants to come, they're welcome. Also, we just ask that people go on our website, survivorjourneys.org, and register. So we know how many people to be prepared for.
Okay, and you'll be speaking yourself.
Yes, and I'd like to second how important it is for providers of many different types of services. I'm a professor at Westfield State in the social work department. I've encouraged all of my students to come because whether you're a teacher in a school, whether you're an Uber driver, you are going to encounter people who are going through cancer, and it is very helpful to know how to respond when people are expressing distress, or how to offer support when people need it. And I think that every one of us can benefit from learning from each other how people are impacted and what we can all do to support people who've had this experience. When I speak nationally about cancer survivorship, I ask many different audiences how many are survivors themselves, and it is very interesting how many people are walking around past you on the street every day that you don't realize are a cancer survivor, or how many people have someone in their family or close friend network, and it is universal. Everyone raises their hands. We could probably ask the same of the audience listening to this program today and know that every single one of us is impacted by cancer in some that we're close to and care about. So we can all benefit from learning more.
On top of that, so that's staggering. We have 16 million cancer survivors. There are wonderful organizations that raise money for cancer research. Very little of that comes to the survivors. Now, the money that people raise in our area that go to national organizations, very little of that comes locally. So that's our focus. Nationally, we're trying to work on spreading the word about cancer survivorship. It's not a sexy topic, but it's a necessary topic. And I'm hoping that people realize that we can do better in our area. Hopefully organizations can collaborate. We don't have services like Reiki or yoga, and I don't anticipate we'll be doing that anytime soon unless something dramatically changes. But there are other organizations like the Cancer House of Hope, Cancer Connection. They have these services. We should be working together, and that includes the hospitals and any other organizations that are cancer related.
All right, and we've posted all of the information for this event on our website, wwlp.com. The month of May is Mental Health Awareness Month, and we'll be discussing diagnosis and treatment options when we return. You're watching 22 News in Focus. You're watching 22 News in Focus. According to the National Alliance on Mental Illness, 1 in 5 Americans is affected by mental health conditions. And the month of May is Mental Health Awareness Month. Many organizations that provide services to patients, their families, and caregivers will be raising awareness through events that aim to educate the public, advocate for public policy, and fight the stigma attached to mental illness. Joining me today to discuss the issues surrounding mental illness in our region are Catherine Cook, Vice President of Behavioral Health for the Center for Human Development, and Andy Boreski, Director of Peer Supports for the Center of Human Development. Thank you both for being here with us today.
Thank you for having us.
Tell me just a little bit about yourselves and how you became involved.
Sure. Yeah, I was somebody who, I worked as a cook and a bouncer, and at a certain point I decided that wasn't really what I wanted to do with my life. When I found out about the peer movement, I was really drawn towards that work. And basically what it is it's people who identify as having some lived experience with the mental health system or a history of trauma, substance use, just any real major disruption in your life. You kind of take that lived experience and apply it towards supporting others through whatever they're going through. We take whatever wisdom we might have learned as we move through tough experiences in our life, and we apply that towards what other people might be experiencing. So when I found out about this kind of work, that's really what drew me for the first time in my life. It wasn't just a paycheck. It was like, this is what I really want to do. And so I've been doing that for the past 6 years now.
And yourself?
Well, I've been a licensed clinician for over 20 years, and I've been doing this work for over 25 years. And really just learning how to take time to listen and be able to hear people's stories, and similar to what Andy discussed, being able to be present for the pain that people have felt in their life and be able to have an opportunity to offer support through listening and understanding.
Okay, and there is a wide range of things that fall under mental illness. Can you just walk me through a little bit about what people are suffering from that you are helping on a day-to-day basis?
That's a really broad question, and I would think that one of the ways to answer that question is through our work at CHD. There are many different reasons why people walk in the door, and some of those reasons are because they've been given a diagnosis by a prescriber that lends them to seek a certain type of care, whether that be psychopharmacological care or care through therapy or group treatment to address various behaviors. And so, first and foremost, I think it depends on what the person is seeking, and being able to ask questions related to finding out what has happened in their life for them. So really being able to approach the individual less from the lens of what is wrong with you, which is what our typical diagnostic environment is like, to being able to ask the question, what's happened in your life that's gotten you here, and how might we be of assistance? And then being able to use some of the really great resources that we have to support people to make the changes that they feel are most necessary for themselves.
It seems there's been a lot of work lately to end the stigma surrounding mental illness. Do you think there's still a lot of work to be done?
Absolutely. I mean, yeah, just that we still kind of use the term mental illness, I think lends to the credence that there is a lot of work to be done, because we haven't really concretely even established that it is that an illness model it truly exists. I mean, that's theoretical, and we don't have a lot of hard science that necessarily backs that. It's not really well understood, like what exactly is going on when somebody presents with the kind of behaviors and experiences that would lead them to be labeled mentally ill. Some of the things, like, I mean, take for example the experience of hearing voices. Most people identify that as a mental illness, when in fact most people who hear voices never really disclose it because of the stigma. It's just as common as being left-handed or having red hair. You probably know people who hear voices and they won't tell you because they're afraid that what you'll think of them, or that they'll be forced into treatment, that people will be like, wait, you're hearing things that I don't experience, you need to be treated right now, like this is an emergency, even though it might be something they've experienced all their life and it doesn't cause them any distress, and they just have learned how to cope with it and realize that that's who they are as a person and that's their experience going through life. Since I started this work and have been involved a little bit with the Hearing Voices Network, I'm trained to facilitate groups for people who hear voices. People have come forward to me, family members I've known all my life, best friends, and be like, hey, I hear voices. And if they didn't know that if they thought I treated that as a mental illness, they wouldn't tell me. They would have never told me. It wasn't until they learned what kind of work I was doing that they were comfortable disclosing that to me.
Okay, so how do you prefer to refer to people who are going through, or not put a title on it at all, just that they're going through some kind of stress or anxiety in their life right now?
I think, again, that's a really good question. If we look at this through the lens of being trauma-informed, and we talk about the work that was done in the 80s through the Kaiser Permanente Adverse Childhood Experiences study, we know that individuals who've suffered significant trauma are more than likely to have a preponderance of both chronic health concerns as well as mental health challenges. And so if we are able to begin to look at, again, tell me the story about what has happened in your life that's causing you to have some of the experiences that you're having now. Being able to say, again, that oftentimes our experiences that are abnormal create normal responses. So we often see behaviors in people that have suffered significant trauma that quickly people will, they'll identify the reaction as abnormal, when in fact it's the suffering that the individual's experienced in their life is creating a reaction that for all purposes is probably matching somewhat of the experience that they suffered.
Okay, tell me a little bit more about what you guys do. Is it just working one-on-one, or you mentioned you're part of a support group?
I'm trained to facilitate support groups. I rarely do. I generally fill in because I work with folks. I work with a team mostly. I do a lot of training, figuring out how, do a lot with policy and figuring out just how we're going to integrate people who work into peer roles into more clinical teams and things like that. Sometimes I do work one-on-one with folks. I have pretty good relationships with individuals, and they'll come to me, and what I do is I just try to meet them where they're at, be like, okay, what's going on for you today? Okay. And sometimes just being an ear for them is enough. Just me sitting there and listening, not judging them, not stigmatizing them, just being like, okay, so that's what's going on for you today. Sometimes that's really all it takes. People need to vent without the fear that I'm going to turn around and try to lock them up or put them on some medication just because they're telling me they have a bad day. sometimes that's all it takes for some people to get through the day. So yeah, when I'm working one-on-one with folks, that's often what it looks like. They'll just pop by my office, and my door is usually open unless I'm very busy, and they can just pop in and tell me how they're doing. And that's often what my work looks like, working one-on-one with folks. Sometimes it's more involved if there's something more complex going on, and we really have to brainstorm around meeting some more complicated needs that the person's expressing, or if something is feeling more immediate or more intense, if they're really in some kind of extreme state or having a real moment of intense emotional distress. Yeah, sometimes that will look a lot different. And I have been through a lot of trainings that help with that, like the intentional peer support training, which was developed by Sherry Mead out of Vermont, and that's really a lot of what we do. There's different trainings and things we go through that help us just kind of to meet people where they're at, but it also gives us specific tools in order to support folks.
All right, we'll continue this conversation after a short break. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about Mental Health Awareness Month. So let's talk about now, if somebody feels like they are going through something mentally and they need to seek some help, what does that process look like? Do they start at a doctor? Where do they start?
Well, folks start in many different places, and I think one of the things that we know is that oftentimes people call our helpline and seek an appointment with a counselor or therapist. Oftentimes they're referred from their prescriber or their primary care doctor. Oftentimes simply word of mouth, that they are talking with somebody who found it beneficial to talk to somebody, and so then reach out and seek services for themselves.
What about someone who has a loved one that they feel might be suffering from something, but maybe that person's not recognizing it? How can someone get their loved one help?
That's a really good question, because I think one of the things is being aware of the resources that are out there, but a person truly has to be interested and want to have the help that could be offered to them. And so education is key. You know, oftentimes family members are seeking support for their loved ones, and we seek to equip them with the knowledge that will help the resources be at the ready. And certainly I think even having Andy in the role that he's in, and folks being able to connect with people much more naturally and providing natural supports, is really going to open the door. Being mindful that it's less about the diagnostics when you're sitting in the room and trying to create a relationship, because we know that 80% of what happens is related to the positivity of the relationship that somebody has. And so the more often we can create a space that's safe and not intrusive and not shame-based, to really allow a person to talk about their experience, the better off their trajectory will be.
Yeah, to piggyback off that a little bit, that's a really tricky situation. I mean, technically what we do is considered person-centered, meaning whoever is in whatever program they might be with CHD, they're supposed to direct the course of what supports and services we're going to offer them. So when you've got a family member who's saying, this person, I want you to help them, it gets into a tricky power dynamic. And it can also do some harm, like if you start calling up like crisis or the police or something, and the person's involuntarily hospitalized, like the forced treatment takes place, the person might be drugged or secluded or whatnot if they're not willing to engage in the treatments that are being, you know, kind of forced on them. That can create a lot of harm, and it can create a lot of mistrust, and it can re-traumatize the individual. So it's something you really have to tread lightly around, and it's something we really try to be aware of, like the impact of what that might look like.
You mentioned the word shame. Is that something you see a lot of people feel? Maybe they're not getting help as soon as they should because they feel shame in this situation?
Exactly. Exactly. You know, so much in the media we see the aftermath of significant events that have occurred, and the first thing we do is we look to see what mental health challenges the individual had. And so it is really a shame-based kind of approach, and so being able to again look at creating space to hear without judgment both the person's experience as well as their ability to flexibly respond in a manner that is going to work for them and that's healthy for them. You know, when we talk about mental health, we're looking at being able to be with our emotions long enough, as uncomfortable as they might be, to then be able to learn from them and be able to respond nimbly and objectively to a traumatic situation or experience.
What would you say to someone who is not seeking help right now that could be, but they are feeling shame?
I think being able to reach out and find somebody that you do trust to be able to talk with, to help you seek that support. And certainly, you know, our folks at CHD are willing to be that person, and they simply need to call. But first and foremost, reaching out to somebody that you trust and guiding that trusting person to be able to guide you to where you need to be to get the care that will best suit you.
There's also a lot of peer support lines that are completely anonymous, where someone can call and just talk to somebody who's been there, who might have experienced similar emotions and similar experiences, that can kind of normalize it for them and be like, hey, I get where you're coming from, let's talk about this a bit. And yeah, those are anonymous, so there's less stigma and shame involved in that, for sure.
Is there a screening process when someone comes to CHD to help find them the right care?
I would say that each one of our clinicians, as they work with individuals, there are certain screening tools that people will use to look at whether or not there's a substance use history or whether or not there's a trauma history. And that may guide the individual in determining what would work best for them. So yes, even in primary care practices, people are engaging in the use of tools such as screening for depression or anxiety. And then what we do with those tools is really help us guide the direction that will work with somebody.
You mentioned you get a lot of people through referrals. Can someone just walk into your office as well?
Well, we do have open access hours in many of our clinics, and so we are continuing to work to expand that. And certainly if somebody walks in, we're going to do what we can do to make sure they get the services that they need.
Okay, we'll continue this conversation after the break. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we've been talking about mental health awareness, diagnosis, and treatment. So let's talk about some of the treatments. Does it depend really on the person, or is there a common theme between treatments?
Certainly the treatment methodology is going to be different for every individual. And again, as Andy spoke to earlier, we really pride ourselves on trying to offer person-centered care. And so, you know, some folks want to try to address their symptomology through using medications, and some people would rather not and simply want to engage in talk therapy or group therapy. And, you know, and some have a combination of both. And so certainly being able to highlight what we know works from an evidence-based practice standpoint, we're going to use some of those methodologies to work with individuals to help them, whether or not they're dealing with substance use and relapse prevention, or they're working to address hearing voices, or they're looking at finding ways to be less reactive to you know, environmental stimuli. So it really is dependent on the individual.
Okay, let's talk about the role of yourself, a peer support specialist.
Sure. I mean, I am trained as a peer support specialist. That's not exactly the work I do right now, but that's the background. Yeah, a peer support specialist is somebody who has the lived experience and the training. That's really important, and it's important because as the peer role first started to be recognized, a lot of people just found someone and were like, hey, you have lived experience, like you've been hospitalized, you've been given these diagnoses, you've taken medications and gotten off of them. You have this lived experience, okay, go peer. And so the people didn't know what to do. They just kind of copied the clinical roles. And really, our role should be a lot different. What we should be doing is not modeling, not using the medical model. We should just be trying to have genuine human relations with people and just meeting someone where they're at and saying, I am a person, you're a person. Let's just talk as two people, and trying to minimize the power dynamics between us. And that's a lot of why the peer work works. There's no threat that I'm ever going to section somebody, like involuntarily hospitalize someone or expose them to forced treatment. I don't give people medications. I don't take notes on them. So none of those things, not to minimize the roles of people who do do those things. That's important as well. It's just ours is separate, and it allows for a different type of relationship that's often more deep. Even there's people who there's been times I've had conversations with people and they've told me things and I'm like, wait, what happened when you told your therapist this? And they're like, and I'm like, you didn't tell your therapist this, huh? And they're like, no. And then they're still quiet and I'm like, wait, you've never told anyone this before. And that's when you really realize the power of what we do, of how peer work can create a really unique connection. So the big part of that, beyond just the lived experience, is the proper training. So that's a lot of what my role is as a director, is making sure that people get the proper training so that they can do the work with integrity and with confidence, and they can empower folks. They can feel empowered that they can do this work, and they can also empower the people they work with to fulfill the hopes and dreams in their life. A lot of what we do is look at people and be like, hey, is this what you want your life to look like? Like, if you weren't here in this program right now, what would you like to be doing? And hopefully, work with the clinical elements of CHD to help people achieve those hopes and dreams.
So is this something that people are doing in addition to seeing a therapist? They can be seeing a peer support specialist?
Maybe. Mm-hmm. It depends. I mean, not everyone, just like Catherine was saying, not everyone resonates with a peer support specialist. Some people, that's not going to work for them, just as for some people medications aren't going to work, or traditional talk therapy isn't going to work. It's just one more angle, one more lens we can approach things. We can look at things through, one more approach we can try. It's really up to the individual to decide if it works for them or not.
One of the things that we offer is, right now we offer what's called community-based flexible supports, and it's for individuals who've had significant experience with the mental health system, psychiatric hospitalizations, and have had lived in group living environments, and we have a team that can be available to individuals that consists of a clinician and an outreach worker. There's the ability to have peer support staff, psychiatry services, and as Andy said, based upon what the individual needs, a team member may move in or move out to really be responsive to support the person as they see fit, and really allow for healthy engagement.
How does someone go about finding the proper care or the proper therapist for them?
That's a good question. Andy, I think, I know you and I were talking about this earlier, and, it takes a while to find the right person. I think it's important first to reach out, but then certainly if you are talking with somebody as a therapist and you don't think that that's a good fit, you need to speak up and say that this isn't working for you, because it's all about the relationship, and it's all about finding somebody that you feel you can connect with and that you can share the parts of yourself that you may have kept shrouded.
Yeah, as somebody who's gone to different therapists, I can tell you that some I've had great relationships with. I can tell you the first therapist I actually trusted was when he disclosed to me, like, oh yeah, I thought I had every diagnosis in the book when I was studying this stuff. And I was just like, really? And that kind of normalized it for me. And I was like, I can trust this guy. And we ended up having a good relationship. Whereas, like, when I was a teenager, you know, I was angry and angsty and listening to loud music. And my parents are like, huh, something might be wrong, and they made me go to a therapist. I kind of just told them what they wanted to hear, and was like, yeah. And the therapist was like, well, I can't help him. He seems pretty well adjusted. And meanwhile, you know, I'm kicking down the front door after school because I'm so mad. So that really is it. It's the relationship. Like, I didn't trust that therapist. I was just going to tell him what I thought he wanted to hear. Whereas somebody else, this other person I saw later, who, you know, opened up a bit to me, that's what got me to trust him. And I've done other forms of therapy that have been sometimes effective, sometimes not. But yeah, I've always known when to be like, I think I've got as much as I can out of this, and I'm going to try something else.
Okay. Let's talk now about veterans. Are there enough services out there for veterans suffering from PTSD?
No.
No, I think we would all agree that there is not enough services. I know that at CHD, through our Disability Resources Program, we offer therapeutic recreational opportunities, and we have a number of therapists who are skilled in providing services to veterans, but certainly we can always do more. You know, this is a time when many folks are coming home after having to really be able to act in a way so different from what they would in their own family, and then to reintegrate back into their family. They're going to need tools and support to be able to be successful.
All right, what are you guys doing during the month of May to raise awareness?
That's a lot of exciting events that are happening at CHD, you know, including being able to come here and talk with you and your viewing audience today. Certain events at each one of the clinics have opportunities for our folks that we serve to come in and have time with one another. I'm certain that you're probably doing some things with your peers, and many good activities. Certainly all you would have to do is go on our website and look, and they're all announced.
Okay, great. And we will have the last word for you after the break. Stay with us. You're watching 22 News in Focus. Watching 22 News in Focus. Today we've been talking about programs for cancer survivors and Mental Health Awareness Month. That's our program for today. We want to thank our guests for joining us, and thank you at home for watching. If you missed any of it, you can watch it in full on our website, wwlp.com. From all of us here at 22 News, we wish you a wonderful Sunday.